Now, after having brief introduction to the vertical tracing of the peritoneum, let's see the horizontal tracing of the peritoneum. For that, we will have to take 4 sections. The first horizontal section we are going to take just below the transverse colon. Second section we will take just above the transverse colon, but at the level of the epiploic foramina. The third horizontal section we are going to take just above the epiploic foramina, and the fourth horizontal section we are going to take just below the epiploic foramina but between the epiploic foramina and transverse mesocolon. So let's see all these sections one by one. So here in this figure, this is the horizontal section of the abdominal cavity below the level of transverse colon. As this is the section below the level of transverse colon, we can appreciate on the left side there is a descending colon somewhere here, and on the right side this is a ascending colon. In the midline there are so many loops of the intestines are there, but for the easiness of study we have drawn only a single intestinal loop which is covered in front by the greater omentum, which is a fourfold layer. This is a greater omentum, which is actually a fourfold layer, and the first and fourth layer they are continuous with each other, and these are derived from the greater sac, while the second and the third layer they are derived from the lesser sac and they are continuous with each other. So this is a greater omentum just in front of the small intestinal loop. On the posterior side, we find the two large vessels. On the left side, this is the aorta, and on the right side, we find the inferior vena cava. So when we trace the parietal peritoneum starting from the abdominal cavity from anterior side, we find there are 5 folds are there just below the umbilicus, and this we have already discussed. And the parietal peritoneum on the right side, these are going to form these folds and going to cover the anterolateral abdominal cavity, and then it is going to form the paracolic gutter before it is going to cover the side and the front of the ascending colon, and then it is going to cover up to the anterior aspect of the inferior vena cava. From here, this parietal peritoneum, it becomes visceral and it is going to cover the small intestinal loop and suspends it with the posterior abdominal wall. Now when we trace this same parietal peritoneum on the left side, same it is going to form the folds just below the umbilicus, and it is going to cover the anterolateral abdominal wall, and then it is going to form the left paracolic gutter, and it is going to cover the sides and the anterior aspect of the descending colon, and then it is going to reach up to the abdominal aorta. From here, this parietal peritoneum, it becomes visceral and it is going to join with the other visceral layer which is going to be formed by the tracing of the right-sided parietal peritoneum. So this is the way how the parietal peritoneum, it is going to cover the whole abdominal cavity just below the transverse colon. So here we can appreciate these are the 5 folds which we have discussed in our previous lectures below the umbilicus, and out of them these are the on the median side, this is the medial umbilical fold. Just lateral to the median umbilical fold we find the medial umbilical fold, and just lateral to it we find the lateral umbilical fold. This parietal peritoneum, it is going to form on the each side the paracolic gutter, the visceral peritoneum which is going to suspend the small intestine, and this is called as the mesentery. Just in front of the small intestine we find the greater omentum. Now let's see the second horizontal section of the abdominal cavity at the level of the epiploic foramina. And for this, we can appreciate that here this is the liver and the stomach is somewhere present here with the lesser curvature on the right side and the greater curvature on the left side. Just behind and below the stomach, we find the spleen. We can appreciate right and left kidney and the abdominal aorta and the inferior vena cava on the posterior side. When we see the parietal peritoneum, this parietal peritoneum just above the umbilicus, just on the right side, it is going to form a sickle-shaped fold, and that is called as the falciform ligament. And this falciform ligament, it is going to enclose the liver on its anterior surface as well as the superior surface and inferior surface. Now, when we trace this falciform ligament right layer, we can say that it is going to cover the anterolateral body wall and it reaches up to the upper part of the kidney, and so the kidney is retroperitoneal in nature and it is going to cover the inferior vena cava. When we trace the left layer of the falciform ligament, it is going to cover the anterolateral body wall and it reach up to the posterior abdominal wall where it is going to cover the superior surface of the left kidney as well as the left suprarenal gland and reach up to the lower lip of the hilum of the spleen where it is going to cover the inferior surface and the superior surface of the spleen and going to continue as the gastroplanic ligament and going to cover the fundus of and reaches up to the lesser curvature of the stomach where it is going to continue as the lesser omentum upper layer and going to form the porta hepatis, and at the right free margin of this porta hepatis it is going to form the lower margin of the lesser omentum, and then it is going to cover the posterior inferior surface of the stomach and going to continue as the gastroplanic ligament and reach up to the upper lip of the hilum of the spleen, and from where it is going to continue as the anterior layer of the lineorenal ligament and going to cover the posterior abdominal wall to continue with the layer of the greater sac. So this greenish area, this is the lesser sac, and the cavity which is present within this bluish area, that is the greater sac. So the communication between these two, this is the epiploic foramina, and within the porta hepatis we can see three structures present, and these are the portal vein, bile duct and hepatic artery. At the epiploic foramen, this greater sac and the lesser sac, they are going to communicate with each other. In the gastroplanic ligament, we have anterior layer and the posterior layer. The anterior layer, it is the continuation of the greater sac, while the posterior layer, it is the continuation of the lesser sac. And the ligament between the spleen and the kidney, that is the lineorenal ligament, where the anterior layer, it is from the lesser sac and the posterior layer, it is from the greater sac.